Hi, welcome everyone. Welcome to today's webinar. Thank you so much for being with us today. We are going to get started right away because we have a lot of people who are already on with us, and we welcome anyone who joins us in a second. This is Karadina Sale with the McSilver Institute, along with the Community Technical Assistance Center and Managed Care Technical Assistance Center of New York State. And I am here to welcome you to today's webinar, which is the applications of play therapy. This is actually a part 2 webinar as a follow-up to the Foundations of Play Therapy relationship, which was presented by Ann Beckley Forrest a few months ago. If you hadn't had a chance to view that, we really recommend you do, but it's not necessary for you to participate in today's webinar. We welcome you anyway, but it's just a way for you to get more information around play therapy. And the link was in the announcement in which you used to register for this webinar, so you can look at that anytime that you'd like. But I really want to welcome Dr. Alyssa Swan, who is an assistant professor in the PhD Counselor Education and Supervision Program at Adler University in Chicago, Illinois. In 2019, she served as an Associate Clinical Director at the Children's Home of Poughkeepsie in Poughkeepsie, New York. And so we're so lucky to have her today. But before we get started, I just want to orient everyone to our WebEx system. It may look a little different for those of you because it's been updated. So we just want to make sure that everybody knows what they're doing. The chat box is still on the right, but you can also hover down at the bottom for the chat box. There's going to be one polling question or chat in at least for Dr. Swan would like to know the setting that you are practicing in. So if you could share that in a little bit, we'd appreciate that. You will be put on mute so that we don't hear any background noise, so it doesn't distract from your listening or the presentation. And if you have any technical issues, please chat to our host, Foong. Thank you, Foong, for hosting today, and she'll be able to assist you. I think that's it. And without further ado, I will pass it on to you, Alyssa. Thank you so much again for presenting.
Thanks, Kara. Hi, everybody. So like Kara said, my name is Alyssa Swan. I have my PhD in Counselor Education and Supervision, and I work right now in Illinois as a licensed clinical professional counselor and a registered play therapist. So I'm happy to be here with you. Throughout today's presentation, feel free to chat. We'll reserve questions for the Q&A portion, but if I see one pop up, there could be a chance I'll respond to it if I'm paying close enough attention. I hope so. But we will have the polling questions, so I'll get to hear from you as we go along. So today's webinar, I personally really wanted to focus on the application of play therapy. So we heard about the foundations of play therapy, and now the application of play therapy is something that is more of a complex, advanced topic than just an easy, here's what to do kind of topic. So when we think about the application of play therapy, I want you to, throughout today's webinar, to really consider the depths of and intersecting contributing factors to what you do as a play therapist and why you do what you do as a play therapist. So today we're going to look at the evidence-based practices that have been designated as evidence-based play therapy approaches. However, just to introduce them, give you some resources, and then go more in depth in different approaches and what it looks like and the theoretical underpinnings for what we do in the play therapy room with children and how it informs our practice. Then we're going to look at some follow-up questions from the first webinar. We're about play behaviors and play themes, working with parents and families, and so I really want to make sure to contribute some of that information as we go. Our hour is going to go quick, so I'll try to keep an eye on time, and we'll reserve the end of the webinar for questions. So feel free to contribute those as they pop up for you. The slides will be available to you afterwards, so throughout it, I've linked all the resources pretty much have a link to the actual resource. So when you download the PowerPoints later on in the week or whenever you download them, you'll have access to the actual links that are provided, as well as a reference page. So one of my, just to start out, I've been doing a lot of supervision. So I've been doing a lot of practice, but recently I've really been doing more supervision, and it's really common, not uncommon, to hear play therapists be worried with this question. I have parents that tell me I should do X, Y, or Z, or want to see X, Y, and Z outcomes, or are worried why they're not seeing outcomes outside the play therapy space. that's just, one supervision question that comes up. I use that as a case example to start with, because in responding to that question, we have to consider a lot of theoretical approaches. So one, a lot of times stakeholders outside of our play therapy room, one might not understand what play therapy is, and so we need to offer in our application of play therapy education about what play therapy is, that it's not just playing with children, that philosophically there's underpinnings of theory that guide our practice, and that play is a big component of play therapy, that we're using the developmentally responsive approach with children. But that's in combination with the therapeutic environment and relationship that is the change agent in play therapy, this relationship, the children's experience within the play therapy relationship, and how they experience themselves and the therapist within that setting through the use of play to communicate. That is what play therapy is. And so we want to be able to communicate that to stakeholders. When I respond to supervisees, we consider all different factors. Other external factors impact how we apply play therapy. But if we go into a play therapy room or session with a child with this in mind, I need to look for outcomes. How do I progress this? What do I need to do to make X, Y, and Z outcome happen? We lose sight of the child. And so when we bring that anxiety in without being aware of it, we can automatically go to our brain and say, okay, what activities do I need to do to externalize or be able to externally demonstrate that we worked on coping mechanisms, or that I saw this activity for depression, so let me use that activity with this client who's coming in for depressive symptoms, rather than using our theoretical grounded framework to conceptualize what is best for this whole family system. And that might include maybe the parents and asking for some more outcomes. Maybe they're saying, hey, we want to feel more included, and so we can pull them in and do some more family work. Or there's anxiety on the parents' end, and we can empathize with that, and maybe that's informing a lot of the anxiety we're seeing with the child in the room. And so we need to consider all these different factors when we're looking at application. Okay, evidence-based play therapy approaches. Hopefully you've heard that play therapy is designated as evidence-based. I just want you to have the resources for the approaches that were designated by SAMHSA before NREP changed over to their new resource center, and the CEBC. So you have them there. We're going to look at each of them more in depth as we go along. There's some more resources for you. APT, of course, has their evidence-based resources. IJPT is a great source for those of you who are researchers and clinicians and practitioners to access really helpful articles. The Center for Play Therapy has a wealth of resources for play therapy approaches and training and research. They have the world's largest play therapy library, which I find a lot of people don't know about, so I want to give you the link to it. And there's also a summary of the play therapy meta-analyses that have been conducted on the link there. Another, I always try in my advanced trainings to let people know that this research database exists, not only for, again, not just for researchers, but for practitioners especially. A lot of people ask me, can you send me some articles that bolster my argument for admin, or bolster our need to bring some evidence for play therapy into court, all these things to justify our practice. So the online play therapy research database was developed in order to have one place where all play therapy outcome research lives and is described in a really applicable way. So I want you to know it exists, and it has this is a screenshot of the screen, and it has a two-sort function, so you can look up the studies and findings from that study and study characteristics of what that intervention was by sorting maybe school, and then also sorting by presenting concern. Looks like some people might be having a hard time hearing. Let us know if you need something. All right. So here's our poll question. Maybe this will give us some time to work out if anybody's having trouble hearing. In what setting do you work? I want to make sure that I can tailor some of this to where you guys are at and working at. So I'll give you a little bit to chat in there. Where do you work? to all those that are answering. I'm excited. I really am genuinely curious where everyone's coming from and the settings you work in. Okay, so someone works in a nonprofit agency, but not necessarily a clinic kind of based approach. So maybe going into homes or schools, it looks like. Wait for others.
So the results should pop up here in a second.
All right. Thank you all.
And we have a text that someone who was having a hard time hearing said that she clicked connect to audio and now she can hear. So if anybody is having an issue, you may want to click connect to audio. Okay, so it looks like most people who participated in the poll are working in a clinic setting, and then some are other. I wonder what other is. If you want to chat in what other is, that'd be really helpful. And then some are working in a school, others a residential setting, and 5 people are working in a hospital setting, and 5 people are working in a private setting.
Wonderful. That's so helpful. Thank you guys for participating. We have a rather large group with us today, so I'm happy to be here with everybody. So a lot of clinic-based and some school, private, and other. Yeah, I'm curious what the others are too. Feel free to chat in, and we'll as we go through. All right, first we're going to look at the theoretical groundedness of child-centered play therapy. Again, I'm going to keep my eye on time. So in order to make the most of our presentation today, I connected the links in here. So you'll have the PowerPoint later and can look through the links of anything that I reference. If I reference something that's not in the links, just let us know and we can add it in before we upload the PowerPoint. Child-centered play therapy, I'll refer to as CCPT. I identify as a child-centered play therapist, although I have great regard for all approaches to play therapy and really all approaches to theory and counseling in general. Child-centered play therapy sometimes gets misrepresented as just building an initial relationship with children and then you do other things. Then you become more directive. Theoretically, child-centered play therapy is a complete therapeutic model in and of itself. And so what that means is that other approaches, such as Adlerian play therapy we'll talk about in just a minute, might look very much so like child-centered play therapy as they build this relationship and establish safety within the play therapy space and relationship. However, they differ because other theories at that moment or play therapy approaches would then become more directive or do other things. And so child-centered play therapy is a standalone therapeutic approach in which the therapist doesn't abandon their beliefs in the child's process once the therapeutic relationship is established. They can continue that same theoretical approach throughout therapy with that individual child, and of course doing parent consultations and other contributing work with that family. However, the belief is that the child's progress will happen in relationship with the child. And so I could never walk into a session with a child and expect what we're going to do that day, because it'll really fully depend on where the child is going to take us that day, what the child needs that day, and what we've been working on. I've seen a lot of sessions observed as a supervisor and experienced myself in which a child will be playing pretty deeply and they've have pretty solidified play themes, at least in that portion of our play therapy work together. And then all of a sudden, one session, things will change. We'll do something completely different. And so even when I have a child who plays similarly and plays out certain themes as we work together, there are certain days and other contributing factors that impact that child's creativity or needs that day. Maybe they need some time alone. Maybe they need to process something with me in relationship, when other times they are usually pretty independent in the playroom. Whatever it is, I can't expect what's going to happen. I don't try to anticipate. I let the child lead me in that relationship with them that day. So I'm just putting that out there. The goal is to help the child be able to act in more self-enhancing ways of being. And so when I say that, what I mean is that as children enter therapy. From a Rogerian standpoint, philosophy, they enter in a state of anxiety which is characterized as incongruence, which means the way I am inside needs to be or is different than others' perceptions of me. So as humans, human nature, we develop rigid views of ourselves that I can't tell you how many children I've worked with collectively that will tell me, I'm a bad child or I'm bad. And this internalized condition of worth of I need to be perfect in order to be good, that is an internalized condition of worth they have in this rigid view of self. And so a goal in play therapy, one, the goal is just to have the counseling relationship, but an outcome will be when we see progress is when that rigidity lessens, when the fluidity is happening more for this child that they know in relationship with me. Sometimes they might spill paint on the floor, and as a counselor, I'm responding in a very different way than maybe people outside the playroom respond to this spilling of paint on the floor, and also very different than the child responds to themselves when they mess up. So I'm responding with example responses of, oh, accidents happen in here. It looks like you're trying to figure out a way to get it cleaned up. Or, oh, that dropped, that scared you. And those ways of responding to what's happening without judging and maintaining a very unconditional regard for the child in that moment helps then the child experience themselves as worthy of someone's unconditional acceptance. And further then, as long as the play therapy relationship continues to go in this way, they'll be able to internalize those new conditions of worth that I don't have to be perfect in order to be accepted, and lessens anxiety. When this happens and children are able to become more congruent, that's when we see the outcomes, which we know from play therapy literature and research that CCPT is effective for reducing disruptive behaviors, anxiety, improving academic performance, all these great benefits that we see from child-centered play therapy are happening as byproducts of this more integrated, self-enhancing ways of being that the child's allowed to discover in the play therapy relationship. So that's the kind of the theoretical background to child-centered play therapy. You'll see some articles there I referenced. That's just a select few that if you're just starting or want some new references to read, those are really good ones that are backed by research, but also practical conceptual work as well. Bratton et al. 2013 study is a CCPT effectiveness study on disruptive behaviors. And Stuhlmaker and Ray, Dr. Stuhlmaker's dissertation research on anxiety and CCPT. So great references for you if you'd like them. The videos, again, I just wanted you to have resources. You can take a look on those and get some demonstration videos if you're more interested in what it looks like. And then there's training and supervision available now on a certification program in child-centered play therapy. Okay, what I was just talking about on the previous slide, these references, people have now researched, these wonderful researchers I referenced, have researched what these therapeutic conditions are in the playroom, and so what the child's experiences of them are and what the therapist's experiences of them are, and how that impacts the application of play therapy. And so we're going to kind of a deeper, advanced level of considering how we are in relationship with children and how these intricate details of how we feel about children, the therapeutic conditions, how fundamentally important they are in advancing our work with children. So the example of spilling paint on the floor, if I had came into session, had a really rough day in my personal life, but also, in my personal life, but also came into, sorry, I was reading comments, and came in stressed, the spilling of the paint might aggravate me more than normal. I usually don't get upset by that. And so that would be an example of when I have to be aware of my own self and not change the way I interact with children or do my own work to make sure that I am congruent and genuine in relationship with children. Structuring the session, we're going to kind of move through the slides now pretty quickly, but as a child-centered play therapist, I just want to clear up a misconception that CCPT just lets children do whatever they want. There are boundaries and limits in child-centered play therapy, just like any relationship. And so in here, you can play with the toys and lots the ways that you want. and there's limited choice giving when applicable, but we're really focusing on the relationship. I'm going to let you read through these slides so that we can keep moving forward. At Leading Play Therapy, Cotman and Minnie-Wallen do an excellent job. If you don't have their book in Partners in Play, I'm not promoting these resources. I just want you to know about them. Cotman and Minnie-Wallen's book, Partners in Play, has appendices full of lifestyle assessments for the children, teachers, parents, a lot of resources that can guide your practice, a whole template for conceptualizing the child from an Adlerian perspective, really fundamental resources for applying play therapy, especially from an Adlerian perspective. You can read the resources I provided, and there's also the training new certification program for Adlerian play therapy through the League of Extraordinary Adlerian Play Therapists, and you have the link there. Wonderful resources. To dive in a little bit more of the application from an Adlerian perspective, there are 4 phases of Adlerian play therapy, and so it's a distinct kind of process, although the process will be impacted by lots of different factors, that individual child and external factors, of course, systemic. But essentially, which will correlate with adult Adlerian therapy, building the relationship, exploring the client's lifestyle, helping the client gain insight into their lifestyle, and reorienting and re-educating the client. So you can see how the application of child-centered is very different than the application of Adlerian play therapy, in which you eventually move into a more directive approach, or collaborative, I think would be more mindful to say, in applying Adlerian play therapy. Other things that you would consider as an Adlerian play therapist are lifestyle assessment, literally doing assessment on what the child's experiences in their life worldview, and also what the teachers, parents, other stakeholders in the child's lifestyle assessment is as well. Crucial C's, goals and misbehavior, and working with parents and teachers. And again, those are just skimming the surface of kind of the application of Adlerian play therapy, but you can look more into that resource. So child-parent relationship therapy, CPRT, is an approach that is a filial therapy model. It's not the only filial therapy model, but it is a filial therapy model. Filial therapy is, we give credit to the Gurneys, back in the 60s, developed this idea of including parents in children's individual play therapy by having the parents be trained in play therapy skills and then offering individual sessions with their own child. And so later on in the 90s, Landreth and Bratton formalized this filial therapy model into a 10-session treatment manual. And so you can access the citations that I provided there. CPRT in general is viewed as a delivery model of CCPT. So we're training in a group format, or filial therapy can be done in individuals as well, but we're training parents and empowering parents with the skills that we have as play therapists, and in the CCPT attitudes and skills, and how they can conduct individual play times with their children at home. And then generally they'll bring those sessions back into the group session where we learn the didactic skills, but we'll also, a component of CPRT, a really important component, is the component of supervision. So we'll watch sessions of parents with their children and do supervision on mostly just empowering them, noticing things that parents don't always notice about their interactions with children, and then be able to increase their responses with children or improve their responses with their own child. The goal is to strengthen the child-parent relationship. We find from research, we know that CPRT is effective in helping children bring themselves under control, disruptive behaviors. Certainly has been well researched with attachment and adoptive families. So a really wonderful resource, and also training provided at CPT if you're interested in CPRT. I personally have lots and lots of case examples of using child-parent relationship therapy with families. Some, and I of course can't show them all, but one I'll share, in that in the group process, parents are not only learning the skills, but also role-playing with each other and building relationship with each other. And so what we find is that the group work is so powerful amongst parents to empower, to validate each other's experiences as parents, and then to move forward and giving each other feedback. And I find that, and I would say this is probably similar to my other colleagues who do CPRT, is that the parents will respond to each other in ways that I don't even know if I was attuned to. So they might notice something I had a parent or lots of parents who will notice things in other parents' videos, and they're like, oh, that's new for your child, and be able to point things out in a way of empathizing with the other parent and noticing their strengths and their growth areas in ways that they can't do individually. And so it pads parents with resources, new skills, and they're practicing right away with their own child. All right, and then TheraPlay is the last one we'll cover in this kind of much depth. In terms of application, I am not personally trained in TheraPlay, and I think that's, I want to be ethical in saying that. However, it's a really well-known and well-utilized approach, and it's also an evidence-based approach, but you can look at for more resources. Essentially, the goal of TheraPlay, similar to CPRT, is to improve the attachment relationship between parents and children. And the way they do that is to intentionally incorporate ways of using touch and activities that use the bodies of both parents and children in facilitating grounded attachment experiences for them or with them amongst the parents and child dyads. So I encourage you to look more into it, and just like the others, I provided some information about training. I see some comments coming in that there's some people have used filial therapy with individuals who are diagnosed on the spectrum, and it sounds like that's been helpful to them. Great, some people have experience. So thank you for sharing that. All right, as we look at time, we're going to keep going. In the general sense of me wanting to provide a training that's grounded in theory, I also think it's really important that not just to know what works and what doesn't work with children, but also be responsible consumers of what is our theoretical orientation and how do we conceptualize children. So when we're tempted to go look for an activity to use with a child, why am I wanting to use this activity? What is it going to help with? And how is it grounded in a theory? And so, sorry, I need to stop getting distracted by the chat comment. So we want to look at all those components because, like I kind of prefaced in the beginning, there are instances or things that get in the way of the counseling relationship with the child. And those things can be the therapist's own agenda, wanting to hurry the process along or progress this in a way that might be therapist-led versus child-led. And I'm not saying that's right or wrong. I just encourage folks to really be grounded in what's driving your application of different play therapy approaches. So getting quality training, ongoing supervision can be immensely helpful. I had a conversation, actually many conversations, I'll keep it general, about what do I do if, a parent is very anxious and I feel anxious in the parent consultation meeting, and I want to make sure that I have an activity ready so that we have something to do because the anxiety seems to be, really increasing during our sessions. And we'll talk about working with parents and families a little bit later. But one of my first questions is always, how do you share this with the parent? And so being genuine and in relationship with the parents and being able to empathize, the same with when we're with children, is super important to us. So instead of just going right to looking for a technique to avoid the anxiety, I think from my perspective, from a person-centered perspective, to be really genuine about, you seem really anxious about this, it seems really hard for you to be here, those kinds of responses, to empathize with what's really going on can be really therapeutically profound and lead into some really vulnerable work with whoever you're working with. So just an example of that. Clinical experience, of course, and client concerns, unique client concerns guide what we do in the playroom. And again, should be taken into consideration when we're applying play therapy approaches. Cultural competence, including development. I'm going to go up just one slide. considering, in terms of cultural considerations, considering toys and materials that are culturally relevant, language, access to services, diversity of cultural experiences, and the intersectionality of cultural identities. And also, those are all important and essential. And also, we want to be careful when we're conceptualizing what's happening with the child when they're brought into counseling, that we're not pathologizing valid discrimination or oppression. And so I say that as a therapist, to encourage we keep in mind our own biases and privileges, and also really work to not pathologize something that might be a response to valid discrimination or oppression they've experienced in their systems or cultures in which that client is coming from. And so, as an example, you might have a child that's presenting with a lot of disruption in the classroom, and so they're not able to sit still. They've been maybe diagnosed with ADHD, or at least are displaying some symptoms that align with that diagnosis. And so it might be easy to, okay, this child has ADHD, very disruptive. Maybe we label them as aggressive. Hopefully we don't just jump to labeling, but as an example. But we need to consider what are this child's unique experiences, because that disruptive behavior or aggression might very well be a very valid response to something they're experiencing. And so we just want to make sure that we're really well-grounded in conceptualizing children in a very consistent and also validating way, that we're considering all of their cultural experiences. Another part of children's culture is development, and so I put this resource, and again, not to promote it, but it's a very good resource. If you don't already have it, I don't get props for doing it, or promoting it, but it's a really good resource, and it goes age by age. And at the end of this child development text, which you have the link to there, there's handouts that you can print out, and there's unlimited copying rights that you can print out on each age group and what parents could expect, what's normal challenges, what's not normal challenges, again, to avoid pathologizing something that might be part of normal childhood at that age. So just a resource for you to have. Something that's important and also had come up in response to the first webinar is distinguishing between play behaviors and play themes. And I agree that this is an advanced topic and one that should be done within consultation and supervision, ongoing kind of conversation, so that we're not ascribing or interpreting children's play or ascribing certain themes to children's play based on our own bias or based on our own experience in the play therapy relationship. Our experience in the play therapy relationship is, of course, essential, but so is considering the child's experience in the play therapy relationship. So I'll give you some examples. Play behavior, by definition, is a behavior that's acted out by a child in the playroom, and it has variation of meanings. So, for example, a child punching a bot bag. That might be a play behavior. This child, multiple children come in and punch the bot bag. That's a play behavior. Another play behavior might be cooking. So there's a kitchen set up, and children like to pretend food, make lunch, pretend to make meals. That's a play behavior. Okay. Another one short example is painting. So painting is a play behavior. Now, the root of why different children use these play behaviors are all different, depending on the child, depending on their presenting concern and their experience, even from session to session and continually between child and child. So then we get to play themes. What is the meaning of this theme for this child? Because we know that we could observe the same play in multiple children, in sessions with multiple children. So it seems like, everyone's playing with the bot bag this week, you might find yourself saying, or everyone seems to be building towers and knocking them down this week. However, the play themes will be unique to that child. And by definition, it's a coherent metaphor from which the child communicates the meaning that they attribute to the experience. And this isn't something that develops in the first session. It might start to develop, but we wouldn't necessarily say, the theme of this child's experience is safety or protection or power and control because of one session with a child. We'll have multiple experiences of a child in which themes are played out through different play behaviors. So I might, I'm going to move forward just for a second. I'll go back. Three characteristics of play themes and how you kind of identify play themes is repetition, intensity, and context. And these come from Dr. D. Ray's Advanced Play Therapy book. Topman and Meany Wallen in their 2016 Adlerian Play Therapy Partners in Playbook also talk a lot about themes, but I'm using this just as so we don't have so much going on. But repetition, intensity, and context. And so when we go back to play behavior, I might have a child who always wants to be in charge. So they're the teacher, and they've described that I'm the student, and they're always in charge. I as the student, I'm getting in trouble a lot. And then they go over out of school play into the next segment of their session, and they're playing with the animals. And there's one animal that's in charge, and the others seem to get bossed around by this animal. And then they go on to another play behavior that is kind of acting out a similar feeling. And so this repetition might be meaningful. Again, this is something that will likely see repetition across sessions for this child. But eventually, if that is something that continues, we might be thinking that's a theme. But we have to take into context as well. So if we know what's happening for the child outside the playroom, if we know, why they were brought into counseling in general, some other things that they might verbalize or play through in the context of the play therapy relationship can give clues to, what this child feels and what their experiences are, even at a felt level of it seems like they always feel like they're the underdog or whatever that might be. As an example, with those, that example, the intensity that goes along and the affect that goes along with these play behaviors can also be indicators of a theme. So if it's really important that they're in charge, like really, really important, you're setting a lot of limits, you find yourself really the child engaging you in a way that's encouraging, that they're having behaviors that may encourage responses of, you like to be in charge, you want to know the way things go, that might lead you to eventually develop, I think this child is really, navigating what's power and control. This theme of the play might be power and control. Now, other children might play out a theme of power and control in a whole different way. That's just one example. All right, in the interest of time, we're going to move forward. Including parents and families in play therapy is very, very, very important. Now, of course, developmentally, we know that children reside, not always, but normally with some kind of caregiver group, most of the time with a family, but it doesn't have to be with their biological family, or some of you worked in a residential setting. And so whatever the context is, involving stakeholders into play therapy, at least through consultation, is very important. And I say that because those of you who also work or consult in schools, having the teachers involved in this therapeutic process and at least in relationship with you and the child can be very helpful. And I'll stop there. I always go on a tangent. But there's some ways we can do this. And so I'll focus on the application. Regularly scheduled parent consultation sessions are one of the most normal and regular ways to involve parents and families and teachers, whoever's involved in that child's life, of course, with the appropriate consents and et cetera. But these resources I offered, Schoolmaker and Jane, Scott Corbett, and Van Fleet, those are specifically written articles about play therapy models for parent consultation. And so I encourage you to look at them. I won't go over each of them, of course, in the context of this webinar because of time, but they're really helpful models for parent consultation to guide your kind of work with parents. But some overall general things that you can do are teach parents skills, so teach them what you're doing in the playroom, how you're responding, how, offering inferences of not necessarily literally translation of what happens in the playroom, but instances of, it seems, when I am setting limits, that X, Y, and G child, they're able to respond to limits. And so I know that you guys came in with this concern that at school, this is just an example, the child is really disruptive, won't respond to limits, and you came into counseling because you thought their child was incapable of this kind of response to limits. However, in the playroom, eventually the child is able to respond to limits, and this is how I set limits. And so being able to educate, that's not always the case. That's just one example. But then what happens is we can also model. So all my interactions with parents and children, I'm trying to, and then again, if we go back to child-centered play therapy being a way of being, how I am with children, how I am with parents, and how I am in daily life should be pretty congruent. And so I hope that I don't have to, I would work on this if, I thought I was having to do too much to be child-centered with the parent. But it's essential to give the child the same things we're asking them to give to their children. So the best way to teach empathy is to give empathy. And that sounds like kind of like a simple thing. But when we're really in with parents, having to genuinely try to empathize with where they're coming from sometimes goes such a long way, even compared to teaching skills, that they feel heard and validated, and therefore their tank is filled up enough so that they can then give that to their child. I can't expect, if they've never experienced a relationship in which they've experienced unconditional positive regard and empathy and responses in a healthy way, it would be almost foolish of me to expect them to automatically respond in that way to their child. So I have to provide this experience relationally with the parent too, and hopefully in other contexts, but if we're talking about individual parent consultation, that they can be able to give that to their child. Okay, so I again don't want to pathologize something for the parent that they is just part of their culture, and we can empathize and grow through that. So giving a lot of resources and skills, oftentimes parents want hands-on things. They want genuinely to help or make things better, but they oftentimes just feel like, I'm not sure what to do, and that's why they're there. All right, and then, of course, I already talked about child-parent relationship therapy. Here's the textbook, and you see the picture of the manual there if you're interested. It's a more formalized way of teaching skills and then encouraging parents to do play sessions with their child, which we know that play therapy is effective. I always say I see children like 1% of their life. If I think of 1 hour out of their 7 days of 24-hour days, and that can be effective in reducing their behaviors or decreasing their anxiety, X, Y, and Z. If I can do that as someone who's just forming a relationship, I fundamentally believe that giving parents tools to be able to do that with their children can be so profound. So I'm a really strong proponent of parent interventions and family interventions. Family play therapy is another realm of play therapy and family inclusion that we don't have time to talk about in depth today, but I want you to have some resources to start kind of getting your interests going, or if you're already doing it, to add on to your practice. Family play therapy is a way in the belief that doing family therapy should include the younger members of the family. So family therapy that's done solely on a verbal basis misses a lot of the family. So if there's a lot of children in the family, or some children in the family, then those children don't have equal opportunity to engage in the therapy in ways that the verbal adults in that way might. So family play therapy involves activities, play, depending on your theoretical orientation, it might look different, but Gill is a great resource to start with. And then Sweeney also has a helpful article, but there's lots more articles on it. Something I wanted to add when I'm talking about parents and families, and I've also mentioned teachers, is that sorry, I'm looking at chats again. I don't want to miss anybody. We get in filial therapy and child-centered or child-parent relationship therapy, we invite parents to create their own traveling toy kits. So we call them filial kits. But I've also helped individuals create these for their school-based or at-home practices. So an at-home or travel play therapy kit, if you don't already have one and you're doing play therapy outside of the clinic setting, it can be a great resource to put together and be able to have a more coherent play therapy space with a designated blanket to, mark off the space for you to use. And so that's what parents utilize as well. I was telling CTAC ahead of time that I'd like to include some pictures or photos of some of the filial kits I've used and know about. So I'm happy to include those, and those will be included in the slides after the webinar, and you can download those if you're interested. And you might have, already developed your own as well. So attitudes for building relationships with parents, we've already talked about this, but I just want to reiterate respect for the parent's role as parent, and that the parent is the expert on their family. You'll see to the other side of the screen that the therapist is the expert on treatment, but the parent is the expert on their family. And then the therapist is the expert on treatment. And so a lot of times in supervision, I'm trying to empower and encourage play therapists to embody this idea that they are an expert in play therapy, to be able to articulate to parents in a confident, coherent way what is play therapy, what to expect, and how are we going to work together to achieve our goals. Respect for the parent's knowledge of the child. They have a wealth of knowledge of their child, and also an established attachment with their child that can be fundamentally, of course, helpful in working with children. Affection for the parent as a person. I think when we talk, even with children, about unconditional positive regard, when we talk about UPR, unconditional positive regard, we have to be able to unconditionally positively regard this human, this person. We don't have to fully accept every single thing that they do behaviorally, but as a person, you are worthy of respect and connection, and I'm going to accept you as a person. I can set boundaries and limits to behaviors, just like with children. I set limits in a way that hopefully, my hope is that it conveys acceptance even when setting boundaries. So I know you think that's fun, but paint is for staying on the paper, or this egg carton. You can choose, the paint is not for the floor. You can choose to put on the paper or the egg carton. And so setting boundaries in this way still maintain the UPR for the child or for the parent in whatever they're experiencing, that maybe the behaviors that you would like to see change. I don't know. There's lots of examples in working with unique parents, but holding UPR for the parent and really empathizing with them goes beyond what we can do even individually. And the clear focus is the child as a client. So being able to conduct parent consultation in a way that isn't counseling for the parent, and of course that's constructive in lots of ways, because you're there to do parent consultation about the child's experience. All right. Okay, we're moving through because we are at time to move into questions. So I'm going to summarize, and then we're going to move into question and answers. And please feel free to include questions if you haven't already sent them, and we'll try to dialogue a little. I know this is a lot of even just broaching the surface of application in 45 minutes, but we're going to try to answer some questions as we go. So today we discussed and got resources on CCPT, Adlerian play therapy, CPRT, and TheraPlay. Please go back and look at the links if you choose to, but there are some pretty good resources. How theory informs intervention, distinguishing between play behaviors and play themes, and also involving parents and families and hopefully other systems into our work as play therapists. All right, we're going to move into question and answer. I see some popping up.
We have quite a few.
All right.
We have someone asked, reorienting and re-educating the client, you had mentioned. Can you elaborate?
Yes, I can elaborate to the extent of, I'm not an expert in Adlerian play therapy, although I've studied and enjoy studying and learning about Adlerian play therapy. But the fourth stage in Adlerian play therapy is really re-educating as you go through Adlerian play therapy. It goes from establishing the relationship into lifestyle, then developing insight into how helping the child develop insight into their own interactions and goals and contributing factors into who they are. This is kind of a broad. So the re-educating, reorienting is the fourth stage in Adlerian therapy and play therapy that goes into giving them new skills, educating them about and collaborating with developing skills that work for them, and how they can then take the insight that they've gained and go back into the setting in which they are living. That's a fairly broad answer, but to follow up, I would really encourage you to read Cutman and Meany Wallen's book. It's wonderful.
Great. Thank you so much.
You're welcome.
We have such great questions here. So the
Great.
majority of my clients are Spanish speaking, someone says. Do you know of these resources or exercises and strategies that are in Spanish?
Yes, I know of quite a few. So that is such an important question, and where we see a gap in access to services. So I will share that. I get excited, and I tell them I share this. Dr. Gustavo Bracena did his dissertation research about Spanish-speaking play therapy clients, and there was a condition where there was an Spanish-speaking Latino condition where the therapist themselves identified Latino and were Spanish-speaking, and then there was a white English-speaking therapist group, and then there was a control group. And what he was wanting to find through his research, and I put the link to this under cultural considerations in the slide that says cultural considerations, so you can read it, and I think it's a great resource. And I'd encourage you to read his dissertation and his findings in that you just probably find interesting. But some concrete resources. The play therapy text has been translated. The CPRT manual has been translated in Spanish as well and is available at cpt.unt.edu. And then I also have here Cookies, Choices, and Kids. I didn't get to it in parent consultations, but it's a pretty well-known resource for parents, and it's also been translated into Spanish. So those are just a couple things to look at, and feel free to email me more if you'd like.
Great, thank you so much. Someone asked, I think this is really important to think about for some of our families involved in the child welfare system, and especially foster parents. Someone asked, how do you think I can engage foster parents that aren't necessarily experts of the child? Maybe they haven't known the child that long, but they're seeing some behaviors, and the child is placed in their home.
Absolutely. That is such a really great question. I saw that pop up in the chat box, and I'm glad we got to it. So for my previous year, I've been working at the Children's Home, and it involves youth who have been in foster care or are in foster care. And so this is really clinically relevant to me as well, but for all the kids that we work with who are in foster care, working with foster parents, oftentimes they themselves are feeling like they don't have a lot of choice in things. So sometimes things happen in the system with whatever state they're working with, and decisions are made for them in a way that they might have not chosen, and they have less control. So empowering the parents that they can make a difference, I think, again, it seems simple, but it's one of the first steps is engaging with them and letting them know, reassuring them that even if they only have a week with this child, they can make a difference. I go back to, not everyone maybe, but a lot of us have had experiences where we've known someone maybe for a passing conversation, an hour, 5 minutes, and they've stuck with you and you still remember that conversation. And in a very, very much deeper way, foster parents can impact, no matter how long they have their children, this attachment and what children know about being loved in a caring relationship. And so, one, depending on how much time you think you have with this family, if you have 10 weeks, I encourage you to do CPRT with foster parents. We had, in groups that I've ran with foster to adopt or adoptive parents, there have been some foster families involved in those groups. There's Their Play groups I know has literature about working with foster parents. And so if you have time and the luxury to do a more formalized approach, I would really encourage you to do that. Otherwise, regular parent consultation and building them up with skills of how to respond to conceptualize behavior through an attachment lens is another piece that's usually very hard, and they're oftentimes the ones getting the brunt of some really hard feelings that their children are experiencing. And so helping them to have a place to talk with you about it, and then helping them conceptualizing together what is going on to guide your interactions with each other. There's lots more we could talk about on that topic.
Fantastic. Okay, we have somebody asking, and I'm sure others can relate. Is there something specific that would be helpful for me to tell parents they can do with their children at home on their own when they're playing with their kids to help, well, in general, to continue the work, but also to help ease a child's anxiety?
Yes, absolutely. So I'm going to say one thing, but it kind of has multiple components. Of course, this is just my clinical recommendation. There's other things that you can do. But I think highlighting the importance for a lot of children, especially those, for all children, consistency and predictability and schedules are very important. for children's development and family functioning in general, and to decrease anxiety. And so I always encourage and really try to follow through with following up and encouraging this to actually happen, is setting a time in the week when the parent feels like their tank is most full, that they have time to really focus on their child. And in CPRT, we, spend time processing when this is going to be and scheduling this out. And of course, then there's accountability that they'll, bring in their play session so that we can watch it. However, even in a parent consultation, I still encourage parents to play with their children for 30 minutes a week. And so we don't want to set a goal of you always have to be playing with your children because that's unrealistic. But 30 minutes a week, usually parents could commit to, even if it's 15 minutes. But it's at the same time every week, same day and same time. And what that does is, of course, we know that child-led play is very healthy for the child and this relationship. And then we can coach parents in letting the child lead and what does it look to be like for play to be child-directed and those kinds of things. But it also gives the child a context of to expect this, they're going to have this time with their parent, which then as a byproduct, they know that they're going to have this time with their parent. So if they, the child really wants their attention, the parent can say, remember we have our time on Saturday, or we have play session in 10 minutes we get to go to. And even just internally, children, I call them internal clocks, children will come to know, just like in play therapy, they know that they have this time to process whatever they need to process through play. So that's kind of the number one thing I really recommend and try to be accountable and following up with parents about how is it going, what's it like, and giving them some skills.
That's really helpful. Thank you. Another question, I'm going to kind of surmise it. I think somebody has a more detailed kind of question for you. They may reach out to you separately. But I think what the question may be getting at a bit that could help others is really, how do you help a child gain insight into their behavior as well as their sense of self? So if somebody identifies as being a bad kid, and that's actually reinforced in school and other environments, but they're not a bad kid, how do you help them to really gain insight into kind of their sense of self in a different way?
Great question. My answer is that, as always, it's going to depend, and it's going to depend on a lot of factors, but one of the most concrete things it's going to depend on is your theoretical approach. So from a child-centered perspective compared to an Adlerian play therapy perspective, we'd approach helping the child gain insight in different ways. The goal of Adlerian play therapy, one of the goals is developing insight in the third stage. In child-centered play therapy, the idea or the example I gave of I'm a bad kid, my goal wasn't necessarily to change this child's perception of them. However, I know that, or I've experienced and I trust that as I provide them a relational context in which it disconfirms that belief about themselves, they'll be able to find themselves viewing themselves in different ways. That kind of wasn't a great way of saying that, but they'll develop new ways of seeing themselves. And so it looks like this in child-centered play therapy. Again, it will be different than Adlerian play therapy. Both okay, just different. In child-centered play therapy, I might have a child who starts, during our sessions early on, will do things purposely to see how I respond, or I assume, I'm interpreting that they might be doing things purposely to just see how I respond. Am I going to respond like other people? Am I in trouble? And here you get to decide if you throw the toys in the sandbox or place them neatly on the shelves. They get to decide. And so that might be my response. And so normally they're thinking, usually when I do this, I get in trouble. This is just an example. So they might be testing it out. And then eventually, as we work through these experiences, they will have gained a relationship in which they don't have to be a certain way to please me. That no matter how they are, the great spectrum of who they are is acceptable to me. And there might be boundaries to that. We have to set limits, choice giving at different times. But in essence, their worthiness doesn't change based on their behavior. And that, as a child-centered play therapist, is something that I wish I could give to every single child in the school, in the clinic, anywhere.
Well said in a little bit of time, as is with this entire webinar. I'm just amazed at how much you covered and how many resources you gave everyone. I thank you so much. I think it's just fantastic that everything in the slide deck is clicked. It's clickable. to the link of the resource. So you want to be sure to download the presentation. It will be sent around to you for those of you that did register to the email that you signed up with. If you need a different email that it will be sent to, let us know. If you could just go to the next slide, because we are running out of time. I just want to share some of our events that will be coming up with CTAC. So we have our family-driven care learning community is going to be launching. So if you all are interested in getting more information around family-driven care and how to be more family-driven in your organization, we are launching an exciting learning community at the end of February. So please join us for that informational webinar. There are some other events that you can see on our, sorry, I'm trying to go to that slide. Kinship Care 101 is happening, and financial assistance for kinship caregivers is also happening, as is evidence-based treatment for first episode psychosis part 2. So please join us for our upcoming events. Thank you everyone for participating, and especially thank you to you, Dr. Alyssa Swan, for your amazing presentation. I really appreciate your perspective, all of your knowledge on play therapy, as well as how much you are modeling to have positive regard for each and every person that you work with. I really appreciate that.
Of course. Thank you.
Everyone has a great, hope everyone has a great day, and we'll see you in the future. Take good care, everyone. Bye-bye.